Jansen.
Hi.
Dr. Troy Myers, pleasure to meet you. Thanks for coming in. All right, so how'd you hear about us?
I saw your truck.
You saw my truck? It's
Yeah.
pretty awesome, ain't
Yeah.
it? Where were you at?
I was across the street getting lunch.
Chick-fil-A?
Yeah.
Yeah, my kid works there. It's pretty cool.
Thanks.
All right, so I was taking a look at your paperwork, and it looks like you've been dealing with some lower back issues for a little bit.
Mhm.
Looks like you kind of like a chronic thing, kind of flares up with sports.
Yeah.
And it looks like a little bit more aggravated after sport. Doesn't really hurt while doing it?
No, not really.
No? Okay, well that's good. Do you know around about time it started though? I know it's a chronic thing, kind of progressing, but can you give me a fine date if you can?
A few months ago.
A few months ago? Was it a specific event?
Not that I could name.
Not that you can name? Okay, that's no problem. What sports are you playing right now?
Not many. I'm just working
Yeah, the
out.
corona stuff kind of got you locked down.
Yeah.
Can't really do anything.
Yeah.
Understandable. Now, I see here that you have a pain level of about like maybe 3 or 4, something like that. Does it ever get higher than that?
Maybe like a right after.
Maybe
a
right
sport
after.
Or activity.
How long does it stay high like that?
An hour or two at least, maybe a day.
Okay. You taking any painkillers, muscle relaxants, anything like that? Ibuprofen, Aleve, ice, heat, stretching, doing anything?
I will go sit down.
You'll go sit down and
stretch
rest?
a while, Yeah.
Does it affect your sleep?
No, not most of the time.
Okay. So, how is this affecting your daily life?
Just whenever it is inflamed,
Mhm.
it just hurts to do more. Some regular activities such as bending over and picking something up could be a little bit harder.
Okay. Okay. Have you tried anything for it?
Not exactly.
What does that mean exactly?
Not professionally.
Professionally.
Like
What have you
going to
done
somebody.
amateurly, I guess?
I'd say stretching and ice packs and just stuff that I could find on Google.
Okay. Kind of give you momentary relief?
Yeah.
Okay. Not a problem. So what we're going to do now is we're going to kind of go over the assessment you did when you were standing. That's what they call our top tier. We're just looking at functional movement and looking to see if your body hits the mark, okay, like different range of motion points. There's 3 reasons why you cannot hit the mark. One is what I call a joint mobility problem. So your joints aren't moving right, something's not in alignment. As a chiropractor, what I do is try to get your body back into alignment, okay? Number 2 would be a tissue extensibility problem. All that means is if I'm trying to move my head this way and this muscle's super tight, it's not letting me do that movement. It's kind of like a tug of war match. So that's where we do some muscle work, some stretching, some cupping, something to try to get that tissue to move. And then now it can kind of allow it to go through that full range of motion. Normally, a joint and a tissue problem are kind of paired together, okay? Third is what they call stability problem. It's where your body is not stable in that joint and it's kind of scared, or you've trained it to do a certain thing, and so it just doesn't want you to go through that full range of motion. So the reason why we do it standing is your body is having the weight of stability of posture, gravity, you're trying to hold posture. Now when I take you to the other room and I lay you down, and that one move that was like really tight with you standing, and all of a sudden you're Gumby, it's not a stability problem, it's a joint problem or tissue problem. So that's where we're gonna kind of break it out to kind of figure out what the problem is, okay? So that we can pair our treatment for what you're dealing with, okay? Now, here we go. Here's your videos of you doing your test. So we're just gonna go very basic over this so that you can understand why I'm doing certain tests in here. But what we're going to do next time when you come in, which is called a report of findings, we're going to pair what I found there and here with the treatment together so that we can map it out all for you, okay? So the first one you had was you just wanted to bend that chin to your chest, right? Oh, great. So it was not recorded.
Oops.
Let's see, unless this is it. All right, we're gonna pretend you're Elijah. Okay, looking for your chin to your chest and looking to see if you can actually touch your chin to your chest. Then I wanna make sure you can extend your head back. You wanna try to make sure your chin to whole face is parallel. I want it to be about 10 degrees above parallel. So that's why I like these little planks right here. It kind of lets me know if you can actually extend your head back. And you can't with this example. Then also rotation. I want to see if the middle part of your face can go over about half the collarbone area. So you're close, but not quite there. One of the things that will help stop you from doing this motion is your posture. So you see how your ear is in front of the shoulder, shoulders roll forward, hips are kind of forward compared to if I was to draw a little dot here from the ankle and go up. You see how you're leaning forward? That lets me know if your posture's forward and you try to do those movements, it's going to lock it up. So yes, you do have some joint problems and tissue problems, but if we don't fix the overall posture too, it's never going to truly go away. So we have to help that alignment big time. Then we want to try to look and see how your shoulder mobility is. Can you touch your finger to that other shoulder blade? You can. It's a little bit funny, especially tight with this external rotation here. So we're going to try to figure out in that other room why is that happening. Then you're looking at for rotation. I should be able to see your other shoulder. So shoulder to shoulder. Not bad here, but you can definitely tell the other, like this side, you're okay. You see how you're not able to get that full rotation. So we need to figure out why that is. We understand that you're playing soccer, throwing athlete, like you have typically good rotation one way and not the other. Here's your toe touch. Can't touch your toes. We need to figure out why. It's come from the hips, hamstring, back, what's going on. Back extension. Okay, yours is a little tight from the hips. We want to try to figure out why is that hurting. Your balance test, yes, we want to try to make sure you can maintain balance, but I'm also looking to see if you kind of kick out and you lose height, lets me know this is a stability problem. You look pretty good there. Eyes closed, definitely a little bit harder. Okay, we need to try to figure out is there an inner ear issue, there's a joint problem. Like we want to try to make sure that is your nervous system is firing 100%, because if you try to stress it through athletics, and it's not working right, then things are going to break down and you're going to hurt yourself. Okay, squat. This is our gold standard. It kind of lets us know how your body is moving in multiple joints, ankles, knees, hips, spine. Can you keep it all stiff? So you see in this example, you're falling forward when you get there, you're falling backwards when you get to the bottom. So we need to make sure, is it coming from your hips, it's coming from your ankles, etc. Because I know you're dealing with lower back pain, okay? But what you have to understand is a lot of times other areas are not moving right, and so there's a lack of mobility there, okay? And since there's a lack of mobility there, it's causing an increased mobility in other areas. A lot of times in the back. Sometimes the hips get stiff, sometimes that mid-back gets stiff, and then it makes the lower back move more, okay? And it causes increased pain, tissue, etc. But, so what my job is to find what we call your painless dysfunctions. Things a lot of times that don't hurt, just don't move right. So we want to try to get those to move so we can get those other areas that are hurting to heal up faster. Okay, so what we're going to do now is go to the other room and kind of break it all out. Okay, so come on with me. You can leave your stuff here. I'll just shut this door. All right, so what I'm going to have you do first, have a seat, face this way. Okay. Now, a lot of what we're going to do first is assess your breathing. So with some of your movement patterns, like you stiffened up at the very end, you can tell that you wanted to hold your breath. That's kind of like your defense mechanism. If your core and your breathing is not right, your core is not going to function correctly, your posture is going to be off. It really complicates things when we do our rehab and your healing process. So we're just going to do a quick breathing assessment, okay? All right. So what I want you to do first is to just take a nice deep breath, and I'm going to feel how your ribs actually move, okay? Deep breath. Let it all out. Deep breath. Let it all out. Deep breath. Okay. Do you have any right shoulder blade issues? Sometimes. So what's happening is this is moving fine, this is not, okay? So we want to try to figure out why this is going on, okay? Now, I'm also going to have you do what they call a high-low test. All I want you to do is put one hand on your chest, one hand on your belly. Take 5 nice deep breaths. Okay, now, you've done 2. Your go-to move is chest. Once you breathe in the belly, okay? Reason why is if you do not expand and use your diaphragm to actually breathe, you're going to breathe here. This is like a stress response breathing, okay? Then it's gonna make your shoulders, your neck get tense, and that posture to kind of be affected, okay? So we're gonna kind of train that. Now what we're going to do is to see how long you can kind of hold your breath. There's certain markers that you can do to let me know if there's any dysfunction, okay? So with your normal breathing, what I want you to do is just breathe in, breathe out, and hold it. Let me know when you want to try to breathe again. Don't cheat. Good. Okay. So you're hitting that mark of dysfunction. So, yep. Now we're going to test your total lung. So I'm going to have you breathe in real deep. Let it all out real deep. Breathe it all in real deep and hold. Pinch your nose. Fellas, I'm telling you some coach. You're good. Okay. Go ahead and lay on your back for me. Now what we're going to do is go through pretty much all of those tests that you did in the other room, but now we're going to do it laying down and kind of break it out and figure out why you aren't able to do those moves. So I'm gonna have you do first is see if you can touch that chin to your chest. Good. I'm gonna kind of help assist you. Does that hurt at all? Okay. So you're still close. You're not there. We want to try to figure out if it's coming from the upper neck or the lower neck.
Sounds harder when you're laying down.
It is because you're like almost like a sit-up kind of thing. Yep. What I'm gonna have you do is you're gonna rotate your head, and then now I want to see if you can touch your chin to your collarbone.
Okay. So it's going to be over
There you go.
Okay.
So you look pretty good that way. So you're a little locked up on this one. You have any headaches?
Not often.
Okay. What is often for you?
Like every day. Like I might have one maybe once a week.
Oh, okay. I'm gonna say every day is very frequent. All right, now we're going to do the rotation stretch. Okay, so what I'm doing is trying to look and see if it goes past your collarbone. You're gonna be with this one. You look pretty good, okay? That one you look pretty good too. I wanna try to clean it out. I'm gonna totally flex your head and I'm gonna have you rotate. You look pretty good. That's what that's doing is breaking out to see if it's coming from the upper neck or the lower neck. If anything, you probably have something kind of going on as left upper neck right here, okay? All right, now we're gonna skip down since you're laying down just to kind of be efficient so you don't have to get up and down and roll around. We're just gonna kind of skip to the lower body, okay? So without, this is the gold standard, it's called your active straight leg raise. So without bending the knee, both of them, how high can you raise this leg off the table? Your arms down, right?
It's just one leg?
Just one leg. Okay, good. Does that hurt at all? Still stretch?
Just like a stretch,
Okay,
yeah.
so you're good with this test. I'm looking to see if you can kind of pass here, you're fine. So it's not truly a hamstring tissue issue of why you can't touch your toes or why your back's hurting when you try to figure out what else is going on.
Okay.
So what I'm gonna do is have you bend the knee. Good. Any pain there?
A little sensor right there.
Kind of pinches at the hip?
Yeah.
Okay. And how about if I bring the hip out? Does that still pinch?
Not really.
Okay.
More like a stretch.
So when you go back and do your squats for weightlifting, I want to make sure you're not doing a narrow squat. You're doing kind of a wider squat because the way your hip is designed, once it gets to a certain point, it's going to pinch on the pelvis part, so the bone is kind of get closer together. So here, you feel how it kind of pinches right there? You want to try to make sure it goes out a little bit. Just the way the shape of the hip is into the pelvis, okay? Now what I'm going to do is do some internal and external rotation of the hip.
Okay.
So, hurts, huh? So you have a little bit of pinching. Now what I want you to try to do also is tuck your butt underneath you, kind of flatten, nope, other way, flatten out the back. Keep it there. Still hurt? Okay. So for this test, your shin should be around belt line. You look pretty good here.
Still about a stretch point.
Yep. So right there is the main. Now if I bring your leg out and do that, does that still pinch?
A little right.
Okay. Can you push your knee up to your chest? that hurt?
No.
Okay. Hold your leg right here. Does that hurt?
No.
Good. Okay.
Just
Do a leg extension.
Kind of
On the inside part of the knee?
Not like a pinch, but just
Okay.
kind of feel like it moves a little bit weird.
In the knee?
Yeah.
Okay. Push your leg up like a knee extension. Does that hurt? Heel to your butt. Does that hurt?
Around like a kneecap.
A kneecap?
Like a kneecap.
Okay, let's test this one. So straighten this leg, raise it up as high as you can. Okay, no problems?
Just it got a little tight.
Tight?
Up to where I got further. with the
Okay.
right leg.
How's this one? Is this pinch in the front too?
A little bit, not as
It's not as bad. So if I do that, does that pinch?
A little bit, not as bad.
Okay. That?
Just a stretch.
Alright. Hold your leg right here and push down. No problems? Okay. Push your knee to your chest. Good. Knee extension. Good. Heel to your butt. Does that hurt the knee like that other one?
A little bit.
A little bit there?
Pinch right there, but not. Like
So this
it
little
was-
bone spot hurt?
Not really. It's like right up in here.
Okay.
There's a little pinch there. The other one was kind of under the whole kneecap.
Okay. Tender to the touch?
Yeah, that second one was.
Okay. Alright. Can you hold your legs right here? Does that hurt your back?
No.
Did your back come off the table?
No.
Okay,
Or
good.
not that I know of.
Okay. Bend his knees. Good. Pick your butt up off the table. So you're doing a bridge. Does that hurt your back?
Yeah.
Straighten this leg. Good. See how
Drop
the hip,
right
see
there.
how the hip drops?
Yep.
Testing to see if it can stay stable. See your other side. See how that one's better? Let's go back to the other one. Having to fight it to keep it up. This is that leg. So this leg is having to keep it stable. So it might be while that hip is pinching and it's causing it not to stabilize more. And then that could also affect your lower back too. Okay. Let me have you sit on up. You're still gonna face that way, but I'm gonna have you do a toe touch, like you're like a long sit.
So I'm just gonna.
Yep, just bend and try to touch the toes. Okay, what I'm doing is looking for a nice uniform spine, and as your pelvis kind of rotating forward, if you can do it, you're pretty good. Now what I have you do is kind of flip over on your hands and knees.
Flip over.
Yep, just
On the
face
table.
face down. Yep. Now come up to your hands and knees. There you go. Can you bring your butt down to your heels? Good. Does that hurt your back?
No.
Good. Does that pinch the hip?
No.
Good. Okay. Now what I want you to do, since you're here, can you put one elbow in the middle of you, put the other hand on the lower back, and then can you rotate your whole body to the ceiling? Look up at the ceiling. Okay. Let's go the other way. So you see how you're kind of stiff, but if I kind of help you, you're able to get a few extra degrees.
Back. Right.
It hurts?
Yeah.
Okay.
Not hurt, but just like tension.
Okay, so this is what I call a lumbar lock position. So it's kind of locking here and just testing here. Now we're going to kind of lock here and just test your lower back. So kind of lay on your stomach. And what I'm gonna have you do is kind of, you're gonna prop up on your elbows. Good, yep. First off, does that hurt?
It's like a little bit of stretch.
Stretch, feel right or left? Or right in the middle?
Center.
Center, okay. Now can you put your arm behind your back again and can you rotate to the ceiling? Does that hurt more in the back? Other side? How's that? No? Okay. Go ahead and lay back face down. Stay right where you're at. Okay. Just lay your head in the middle. Okay. Tender to the touch?
No.
Good. Hip?
A little bit, like pinching on the back.
Back part?
That was
Through here? Okay. Anything on the left?
not as bad, but a little.
Okay. Without bending the knee, can you raise this leg off the table? Does that hurt?
No.
Other side? Does that hurt?
I feel a little bit in the right hip.
On the right hip?
Yeah.
Okay. So what I'm gonna do now is we're gonna look at your internal and external rotation with now your hip in a neutral position versus it bent like in a squat, like when you're laying on your back. So everything looks good range of motion wise that way. That way is pretty good too. Alrighty. So what's kind of going on is your pelvis is
kind of up
Okay.
and rotated a little bit, and it's made these muscles really tight and tender, and it's thrown off the hip too. So you have definitely an alignment issues going on here. That's also really tight tissue-wise, and it's also making the hip really, really tight and pinchy in the front, and it's not allowing it to stabilize when we're trying to take one leg away, okay? You had a little bit of that mid-back issues going on, all right? Now what I want you to do is sit on up, or stand on up. Let me actually have you sit face that way. Let me get the stick behind you. Now we're just going to isolate one more thing because I want to make sure that rotation of your mid-back now that it's sitting is still okay, but we're taking the hips out of the equation. Put this on your back, you're gonna rotate one way, rotate the other way, but you're gonna have your knees together the whole time. So, yep, behind your back, rotate. Good, other side. Good, any pain with any of that? Perfect, all right. Now what I want you to do is stand on up. Can you take a few steps with just on your heels? Good. Any pain? Go back, but on your toes. Yep. Okay. Good. Any pain there? Okay. All right. Now what we're going to do is I just want to test and see if your ankle mobility is okay. You're gonna have your hands on the wall, kind of a few feet out. Just gonna stand normal, hands here, but you're gonna have one foot in front of the other. And I want to see if you can bend as low as you can without that heel coming off the ground. Just like that. Perfect. Good. Other side. Good job. So it's not an ankle problem, so that's a good thing. All right. Now we're going to test one more thing to look at your stability. Since that's the one thing that kind of seems to be flaring up on you. What you're going to do is you're going to have your knee on the ground, but I also want you to have a nice upright posture, and I want to see how far you can get that foot in line with the other leg.
So like this,
Just like that.
and then how far this can go.
You got it without falling over.
So stay on though.
That's fine.
Make sure it's like mine.
Okay, take a nice deep breath. Good job. Switch sides. This side is the hard side.
Of course it is. That's what I think.
Good. Deep breath. Good job. All right, come on up. Awesome. How'd that feel? You all right?
Yeah.
Okay.
It's definitely a lot harder in terms of balance on
On that side?
Yeah.
Okay. So what it does is you've got some work to do. You definitely need to kind of see what's going on with that pelvic alignment, especially since it's a chronic thing. You see what's going on. What I'm gonna do is I'm gonna send you out for an x-ray, okay? Our x-ray facility is half a mile away, so it's a few turns over. What I'm gonna do is write a little referral for you. You go in there, hand it to them, and they'll get it done that day, probably in like 20 minutes, okay? And then we just need that before you come in on your next visit. Remember, we're gonna do the report of findings where we go over everything. Okay, now since I kind of put you through the ringer, what we're gonna do is do a little electric stim on your lower back, just to calm it down a little bit, okay?
Last one piece on it.
I know you said it. You did say it.
Then we had to go and lay face down. You ever had electric stim done before?
Yes.
Okay. Alrighty. Boom, boom, boom. Alright, I'll put it on there whenever we're done, but we need to videotape you exiting too. Okay. So come on with me, and I'll put you on in a second. Just pretend like you got your shoes and stuff on. Alright. And okay, so we'll see you later. Haley's gonna get you all checked out and get you ready to go. Awesome.
Alright, Jansen. How you feeling today?
Good.
Yeah? Did you do electric spin? Was that your first time doing it?
Yeah.
No, it wasn't. Perfect. Okay. How's your back feeling? I know you kind of came in here, it was bubbling a little bit. Feel
Yeah.
better? Kinda? Okay. Well, let's get you in soon. I know, let's see, it's Tuesday. I know that he's gonna want to try to get you in quickly, so like towards this end of the week, so we can get you in here, we can get you started, and he can kind of talk to you about the results that he has seen during your test, okay?
Okay.
So what day works best for you?
Tuesdays.
Tuesdays work best. Could you come in possibly by the end of this week, like a Thursday or Friday?
Yep.
Yeah? Alright, let's see. Friday, could you do 7:30 in the morning? Come in that early?
Yeah.
Perfect. Alright. Perfect, you're in there. check with your insurance today, it's a $25 copay. How would you like to pay for that? Do you wanna put the card on file?
Sure.
Great. Okay, perfect, so we're all set on that end. We're scheduled, and we look forward to seeing you Friday morning.
Okay.
Perfect, thank you so much, Jansen, have a
Thank
good
you.
one.
You too.